Hello, everyone, and welcome to Holy Cross. We're so excited to be welcoming you back to campus. I'm Kelsey DeVoe. I'm the Director of Health Services here on campus, and we have been working really hard to get everyone back here safely in the midst of this global pandemic that we're living in. So I really appreciate you taking the time to listen to this topic on COVID safety on campus. It's really, really important that we all do our part to work together to have the safest semester we can have. So I'd like to go through some of the COVID basics and then some of the things that we've put in place to keep you all safe, and then ways that you can help work with us to have a successful semester. So we'll start with the COVID basics. I really love this timeline. I think it gives a great view of why we do what we do. If you look on the left-hand side of this graphic, you'll see a person being infected with COVID. And the incubation period of COVID ranges from 2 to 14 days. And what that means is from the time of your exposure to the time you develop symptoms can be 2 to 14 days. On average, most people will develop symptoms about 5 days after exposure, and almost 100% of people will develop symptoms by day 10. So, this incubation period is where you would be in quarantine. So, for example, if this person on the left knew that they had been exposed, they would quarantine until the incubation period was over and they could be sure that they didn't have COVID. And the point of quarantine is to isolate yourself away from others so that if you do end up developing COVID, you don't infect anybody else. And our quarantine period used to be 14 days, and it's now shortened to 10 days. And the reason we were able to do that is because of what I said earlier, that about 100% of people develop COVID within those first 10 days. There are some testing that we need to do during the 10 days of quarantine. We'll test you a couple times, and as long as your tests remain negative and you have no symptoms, you can be released after 10 days of quarantine. So let's say this person here on the left did not know that they were exposed to COVID and did not quarantine themselves, but continued moving about campus. Eventually, they may develop symptoms. So they're moving about their day, and then they enter into their infectious period, which is this yellow period here. Now, the tricky part about COVID is your infectious period begins 48 hours before you have symptoms or before you test positive. That's what makes COVID really difficult to manage and to reduce transmission, is most people do not know that they're spreading it when they are. So that obviously makes it really difficult to control. So this person developed symptoms on day 14 here. But for day 12 and day 13, they were still infectious and transmitting COVID. And so anyone they came into contact with on those days would then be close contacts. So then on day 1 here, they develop symptoms or they have a positive test, and we would put them into isolation. Isolation is the term that we use for those who are positive for COVID, and quarantine is the term we use for close contacts. So this person would enter into isolation for about 10 days. And as long as their symptoms have improved, they could be released after 10 days. Some people do have more severe illness that lasts longer, but in our college population, we've really seen folks have pretty mild symptoms. And we're going to talk about the symptoms as we go on. So this graphic I really like. I think it explains perfectly what I was saying with the tricky part about COVID. You may have heard that the COVID transmission rate is for every one positive person, they infect about 2.5 people. It doesn't sound like a lot of people, but in reality, it really is because you can exponentially grow that number very quickly. So this person on the top doesn't know they have COVID, and they infect the 2 people below them who didn't know they were infected. And so they infect 2 people each. And then let's say this person down on the 3rd level develops symptoms and tests positive for COVID and traces it back to the person they had been in contact with earlier, who never even knew that they were in contact with this first person who had COVID. And so as you can see, it went from one person unknowingly transmitting COVID to quickly having hundreds of people infected with COVID. And on a college campus, the transmission rate is much higher because you have a lot more contact with people. So, on average, on a college campus, one person will infect another 5 people. So, you can imagine without any COVID mitigation measures, we quickly would have hundreds and hundreds of people positive for COVID. The reason why we're doing all of this work that we're doing, social distancing, testing, wearing masks, is so that we can reduce transmission as much as possible. We know we're probably never going to get it down to zero, but our goal is to get it down as low as possible. So if this one person with COVID only infects one person, and that one person is wearing their mask and not gathering with lots of people and limiting their contacts, they'll only infect one person. And instead of having hundreds of positives, you just have a handful. So, this I think really explains why we're doing what we're doing. And what are we doing? We have lots of safety policies on campus. We have a universal mask policy, which is part of the student spring guide. And I really encourage you all to look at that. And that mask policy says that you should be wearing a mask anywhere on campus except for in your bedroom with the door closed. You may have a shared bathroom and you may want to wear your mask into the bathroom. Obviously, you'll have to take it off to brush your teeth and to shower and those sorts of things. But wearing a mask, if both parties are wearing a mask, it significantly reduces the transmission rate of COVID. So we ask that all students and staff and any visitors on campus are wearing a mask at all times, even outdoors and within any of the campus buildings. We also have our testing policy. Students are expected to test twice a week, and those tests should be on non-consecutive days. So what that means is you wouldn't want to test on Monday and Tuesday and then not test again for the rest of the week. You would go quite a long time without having a test. So we encourage you to look at your schedule and figure out what works best and try and plan your tests for one towards the beginning of the week and one towards the end of the week. You really don't want to go more than 4 or 5 days without having a COVID test result. Our staff is also testing weekly or twice weekly, and they follow the same protocols that we do for testing compliance, which is great. And I'd like you all to remember a negative COVID test is not a free pass to skip the COVID safety protocols. A negative result only tells you that you have been safe for the past 48 hours. Remember that little sticky period in the middle where you don't know that you're infected, but you are still transmitting COVID. We've had lots of people test negative and then 2 days later test positive, and all those people that they saw in between that negative and positive test were exposed to COVID and had to quarantine as close contacts. And so we really want to encourage you to not use a negative COVID test as a security blanket. It should make you feel good that you're currently nice and healthy and you haven't infected anyone previously. But going forward in the future, you still want to remember that it doesn't take long to turn positive or to develop symptoms, and then you will have exposed others as well. So always keep up with your testing and continue all of the policies, even with a negative COVID test. We also have occupancy limits posted all over campus. You should make sure that you're adhering to those limits in the bathrooms, in the dorm rooms, in the common rooms, and any of the common spaces on campus throughout Hogan and other areas. We're also asking everyone to abide by the Massachusetts guidelines, depending on what phase we're in, and making sure your gatherings are always less than those limits as well. We have a guest policy, which is encouraging folks to not have visitors on campus this semester, and we are not allowing visitors within the residence halls this semester. Students will also get a little sticker on their ID badge that says what res hall you live in, and you are not supposed to go into anyone else's residence hall, and public safety will be able to see which hall you're from. I wanted to share with you the HC alert levels that we have on campus. This is a really great way for you to kind of keep track on what's going on campus and how things are going. The COVID response and reopening page on the Holy Cross website is a really great resource. I really encourage all of you to visit this website and click through some of the FAQs and resources we have here. The first thing here you'll see is our campus alert level for the 2021 semester. Our current status is orange. That is not related to any current metrics or high numbers of cases. Rather, we felt it would be the right move to start our semester off in an orange status, meaning things are a little bit more restricted and locked down, so that everyone could move in and get here safely, and we could sort of build our safety bubble here on campus. So, our campus alert level is determined by a number of metrics, and our alert level could be green, yellow, orange, or red. Red would mean that we are sending everybody home. So, our goal is to not get to red. Orange has some restrictions like no guests in your room, mostly remote learning, dining is takeout only, and limited access on campus. Yellow is a little bit more movement is allowed in-person classes, dining is open but de-densified, and shared spaces on campus are open. Green would be back to normal, which will take us some time to get there, and we likely won't see green this semester. But our goal is to avoid a red. Now, if you're interested in the policies, they're all here. And if you're interested in the metrics that we use, you can visit our COVID dashboard. This has all of our testing data on there. It shows you how many positive tests we've had that day, how many students we actively have in isolation and quarantine, how many tests we've done, and then it shows you the Massachusetts numbers. And if you hover over, you can see the trends that we're under currently in our area. So we use this data to determine our alert status. Other pieces of data that are with this, the metrics is compliance, testing compliance. If our students are not complying with their testing, obviously that puts us at higher risk and would put us in a higher alert level. Another metric that we use is COVID conduct. So if we have a high number of COVID infractions, meaning students gathering in large groups or a lot of students being reported not wearing masks or whatever it may be, that again puts us at a higher risk. And the last metric that we use is our number of students in isolation and quarantine space. And when the semester starts, you'll be able to see how many rooms are occupied in our quarantine space. And that will help us determine if we need to increase or reduce our alert level. So again, I really recommend that you check out that website. There's tons of information on isolation, quarantine. There's videos on testing and on what the quarantine space looks like. It's a really helpful page to look through. Now, we're doing all these things. We're trying to be as safe as we can, but COVID is pretty prevalent right now. So it is possible that you may be exposed to COVID or you may develop symptoms that could be COVID. If this happens, you want to call health services as soon as possible. We're here to talk to you about your exposure or your symptoms and help make a plan. We can get you tested in health services safely, even if the testing center is not open. And we can help you isolate yourself while we're waiting for those test results to make sure that you don't expose your roommate or anybody else on campus. We really want to encourage students to take your symptoms seriously. Many of our students who have tested positive for COVID had very mild symptoms. And when questioned or when they learned that they were positive for COVID, they said, I didn't think that I had COVID. I thought that I had allergies or it was my asthma. So we really are asking all of our students to not assume that your symptoms are something else. Any symptom could potentially be COVID. And we want to make sure that we're testing you as soon as you develop symptoms to make everything as safe as possible. So again, you'd want to call health services with any of these types of questions. We are not here to enforce any of the conduct policies or anything like that. We really are here to just keep you safe and healthy as possible. Now, it is possible that you will end up in isolation or quarantine as a close contact or a positive case. And so I just want to quickly go through that and make sure everyone feels comfortable with this process. We've really worked hard to make it as comfortable as a place as possible. It's hard to be alone for 10 days, but we really worked hard to make it a comfortable experience for you. Now, isolation, as I said, is an infected person, someone with symptoms or with a positive test. And close contact is quarantine. So that's someone who's been exposed but is not sick. To be a close contact, you have to perhaps live with the infected person or have had face to face contact with or without masks within 6 feet for cumulative 15 minutes. So if you see someone a couple times throughout the day and it adds up to greater than 15 minutes, you likely would end up as a close contact. Direct physical contact also would make you a close contact. Isolation is 10 days as long as your symptoms have improved, and you would be able to leave isolation on day 11. And quarantine is also 10 days long, depending on your test results. So, as long as you've tested negative after day 8 and you remain asymptomatic, you can be released after 10 days on day 11. Now, quarantine, if you live within 250 miles of the college, you must have a plan to quarantine at home or at a family's home. The college will not provide you with a quarantine space. The reason that we do this is for every one positive, there are multiple students that need to quarantine. So, for example, if one student has 6 close contacts, that's 7 people that need to take up a room in our isolation and quarantine space. In an effort to preserve our isolation space for those who are sick, symptomatic, or positive, we've decided to send those who need to quarantine home if they live close enough. Now, there is a way to request an exemption, and you will be receiving information from the college on how to do that. But I really encourage you all to talk to your family about how you can safely do this at home. Perhaps you have a family member close by who has a separate bedroom and bathroom that you could use. Perhaps your family would prefer to put you at a hotel, or perhaps your family would have a safe space for you at home. But this is something that you should all be thinking about. If you live close to the college and you are a close contact, you will be asked to quarantine at home. We will send you home with mail in tests to use during quarantine so we can make sure that we're giving you access to testing. For isolation, you will not be sent home. Anyone who's positive or symptomatic would be allowed to stay on campus regardless of where they live. And then afterwards, you're considered COVID recovered and you do not COVID test for about 90 days. I know this is a ton of information and we could continue talking about this for hours and hours. So I really want you to reach out with questions and again, look at that COVID response and reopening page. There's different sections on isolation and quarantine with frequently asked questions, on testing, on what to do if you're sick. Any questions, please feel free to email me. My email is here, or to call health services at 508-793-2276. You can also visit our health services webpage. We have all sorts of resources there. We have a physician on call that you can call after hours. I suggest you all program these numbers into your phone if you need them and you're not sure where to go. Again, any questions, please feel free to email me anytime. And welcome to Holy Cross. We're so happy you're here and so happy that you're willing to participate in all of these policies to keep our campus safe and open through the semester. Thank you.